Here, we discuss topics designed to explore the full spectrum of mental well-being. You'll hear from experts and listen to personal experiences that inspire and inform. So, whether you're seeking insights, solutions, or just a dose of motivation, this podcast is your perfect companion. Hit that subscribe button and join us on this incredible journey to mental being. Your whole health starts with your whole mind. Let's get started. Hello. We're back again. Thank you for everyone who's listening. I am Dr. Bolanle Akinrambi, psychiatrist and founder at Bright Minds MD, a private practice serving New Jersey and New York via telehealth, where we help people with depression, anxiety disorders feel better and live better using fewer medications and wellness practices. Don't I have a treat for you today? I have here with me Dr. Andy Watkins-McCall, a nutritional psychiatrist, right? Nutrition. I'm going to let Dr. Andy introduce herself and tell us a little bit about what she does and what her field is, but I'm going to let her tell us about herself. But I'm super excited because we all talk about nutrition, wellness practices, and what a treat to be able to listen to someone who uses nutrition as part of their treatment armament in mental health. Thank you for joining us, Dr. Andy Watkins-McCall.
Thank you. Thank you for having me on the show. I'm very excited and passionate about nutritional psychiatry and really appreciate the opportunity to talk about something that's near and dear to my heart and brings a lot of joy in the way that I treat my patients. So I'm Dr. Andy Watkins-McCall. I am the CEO and owner/founder of Freedom Mind Well Care and Consulting. I practice outside of Maryland and I do see patients via telehealth in the areas of District of Columbia, Maryland, and Virginia. And as you mentioned, my area of practice and focus is nutritional psychiatry. It's something that is growing in our field of psychiatry, and I think it's beginning to expand, although I feel like it's been important for the beginning of time, right? How do we nourish our bodies and how do we take care of ourselves? And how do we fuel our bodies in a way that is mindful and inherently promotes overall wellness? I think we oftentimes look at our mind and body as separate things when we know that although traditional medicine compartmentalizes things, right? You have a cardiologist, you have a psychiatrist, you have an oncologist, you have all of these different specialties. However, our body works together in one working system, and its homeostasis is really based upon everything working together. So the practice of nutritional psychiatry is about acknowledging that and honoring that, developing a mindfulness practice in the way that we consume foods, and really reframing the way that we think about nutrition and diet as a way of nourishing ourselves. I think we've really gotten away from that. In society, we think about what do I have a taste for, or what do I want to eat, but what does our body need? So it moves us back to that traditional science of thinking about nourishing ourselves and wellness and how that impacts our overall neurological system, but also how that feeds into how our overall body is being managed for wellness.
Thank you. That is a lot. I feel like you covered my next question so well in that you talked about why it's important and you talked about what it is. I don't know if you want to highlight on that a little more, but I think you did begin to talk about nutritional psychiatry really being a way of starting to eat mindfully in a way that nourishes our body and honors the fact that we are one system after all, not several compartments of systems, the way we divvy things up in traditional medicine. So why important?
Yeah.
To be mindful of nutrition in terms when we look at it from a mental health perspective?
Yes, I love this question because it comes from a lot of different angles that I think we don't really think about, honestly, because we are not mindful, I think, in society about how we eat. The practice of nutritional psychiatry inherently in the way that the modality of treatment encourages mindfulness. In order to engage in nutritional psychiatry as a form of treatment for mental health, it requires you to be aware of what you're eating and be aware of how it impacts how your body feels. Oftentimes in our society, we're on a rush, go, go, go. We often eat while we're doing other things. And we often eat to either cover up emotions or to self-soothe. The first part about nutritional psychiatry is that it encourages the person to engage in mindfulness in the way they eat, but it also encourages the patient to adopt a somatic practice. Part of overall healing is you need to know how your body is feeling. A lot of times what patients that I see in my practice are coming in for treatment because of unresolved issues that have been in our bodies and causing a lot of stress and chronic inflammation, and we've ignored them. By engaging in a practice of mindfulness and eating, it also encourages to be aware of how is my body feeling in the moment? How did it feel before I ate this thing, and how did it feel after? Why am I wanting to eat this item? Am I feeling sad? Am I feeling anxious? Am I feeling shame, grief? Do I need to cover up another feeling? So just really adopting how do you feel and how does that impact your eating behaviors? So that's the first part of it. The other thing is it encourages lifestyle modification. In order to be mindful about how you eat, you have to take the time to do that, right? So it takes away from a practice of being distracted from how we feel to being able to say, I'm going to organize my life around nutrition because it's important. In our society, in our culture, eating and how we consume foods can be a practice of healing, right? When you sit down with your family and you eat, are you mindful about your eating? Are you talking with your family? Are you on your phone? Do you know what you ate and how much you consumed? Are you eating your breakfast on the go, or are you being mindful about how you're eating your breakfast? What did you decide to eat that day, and how did you decide to eat it? It's also incorporating behavioral lifestyle modification that in turn encourage other healthier lifestyle changes that will impact your overall health. When you eat better, and you're mindful about how you feel, you're probably going to be able to make other better decisions about how you exercise and how you sleep. And finally, the bigger thing is when you eat affects how you feel. How well you're eating nutrient dense foods, or if you're eating things that are empty calories, that's going to cause you to feel sluggish, right? If you're eating more nutrient dense foods, you're going to have less sugar spikes. You're going to feel like your mood is more even, and you're going to feel better overall. Eating healthier for your nervous system also will encourage you to be healthier in other comorbid medical conditions, right? Oftentimes people don't come in our office, again, going back to this compartmentalized, so you're coming to us for mental health, but you may have diabetes, you may have hypertension, autoimmune disorders, all of these things all benefit from eating healthier, right? And the better that you manage these other disease processes, the better that your nervous system will be better. And you'll be better equipped to have overall better improved mental health.
Absolutely, absolutely. If you're eating in a way that treats your other illnesses,
yes,
your mood will be better, your mind will be better, everything will be better if you're eating in a way that honors the way that your body is functioning. I also, as I was listening to you, was hearing about the mindful eating, how this could harken really well to my eating disorders patients, a big part of it. But I know that's not all you treat or even a primary focus for you. I'm thinking about depressed patients, anxious patients, and I'm wanting, and I know a lot of us now, more people anyway, more people should be talking about the gut-brain axis and the connection with that and how it affects our mood. But I thought this would be a perfect opportunity also to talk about that a little bit, how our guts connect with our brain and how that impacts our moods, so that people can understand a bit better why this is important.
Yeah, absolutely. I think this is the prime time for us to start being more aware about the gut-brain axis. Research continues to develop about the way that our gut and our brain communicate. But I think we have enough science now to really be able to say with confidence that it's a bi-directional relationship. And our entire nervous system, being the largest nervous system, primitive in the gut, and really has been able to develop even primordially before the brain was. Our gut was really evolving and has become very sophisticated. And there is, again, we are in this nervous system that feeds off each other. So, what the enteric nervous system is feeling and what's going on in your gut will give information to your brain and vice versa. And I like to explain it to patients in a way that's really simple and easy to understand. When people say, I have a feeling in my gut, that is real. So your brain is perceiving a threat, right? And it's telling your stomach, oh, wait, you might want to hold off on digesting food. You need to run. We talk about these two different very well studied parts of the nervous system, the parasympathetic and the sympathetic nervous system, and how that is balanced is really guided by this gut-brain axis, and how
we're giving information back and forth.
Exactly, and how we're sending those signals And the way that we live our daily lives, the way we nourish ourselves, all those things impact it. And the other thing I think that's important to highlight about that is the microbiome, right? Oh my goodness, I could talk for forever about this. I love learning about the new developments, our understanding of the microbiome system, because we used to think, okay, we need to have a healthy microbiome. We need to have a good, healthy gut. And we need to have bacteria that are encouraging us to have a healthy overall wellness in our stomach system and our GI system. But we know that gut microbiome has more power than we thought, right? So they also have the power to send signals to our brain as well. What we consume and how we create an environment that fosters a healthy gut microbiome is essential, right, to overall health, not just for our nervous system, but for our overall health. So if we're eating things that are taking away the good gut bacteria that would be telling us to stay calm and to release the good endorphins, and we're eating these things that are really liked to under stress, high sugar, high fat diets that foster the unhealthy gut that are telling us be slow, gain weight, let's take on more of the fat. All of those things are going to play a role. Being aware that what we're eating is not just providing nutritional support, but it's also providing nervous system support for our gut. And that is going to send information to our brains and keep us overall healthy and tell our brains how we should be feeling and how we should not be feeling.
Thank you. That is really powerful, I think, for more and more of us to know. And I'm going to just highlight it, that our gut biome, our gut flora, communicates or at least regulates or affects the production of endorphins, neurotransmitters that then communicate to our brain how we should be feeling. So we definitely want to nurture a flora, a biome that supports how we want to be feeling. I think that's what I'm taking away from that. I'm also taking away that if we are stressed out, then we affect, we either eat in a way that doesn't support a good flora or affects our systems in a different way, maybe shoots up our cortisol, and therefore we're more tired, more stressed out, more angry. So it becomes really important on a micro level to be aware of what's going on inside our stomachs and making sure it's supporting how we want to feel. Very powerful. I want people to walk away from that. So having spoken about that, if we have to think, right, someone's listening today and saying, so how should I be eating? And I want to just say to anyone listening today, this is not medical advice. This is produced for education and entertainment. So we're not treating you. If you want to really have a consultation, please reach out to Dr. Andy to get a consultation. But throwing this out in general, since you're spending time with us, what are 3 things that people can walk away with? Maybe that they can do differently, eat differently, or something they can modify, actionable items they can go away with today to support their mental health and their gut?
Sure. First thing is for people to start slow, not to feel overwhelmed. So I love that you said 3 things because I think when people are like, oh, I need to change my whole diet, then you start to feel like, oh, this is too much. I'm just not going to do it. So I think some very simple steps first is consume more water. Hydrate. Make sure that you just change the way that you consume water. So maybe you can just get a larger water bottle and carry that around with you. That's a very easy first step, right? To make sure that you're hydrated and you're nourishing your body with enough water, so at least you're not feeling tired or sluggish because you're dehydrated. That's the first thing. Second thing I think is trying to incorporate, you don't have to take everything away, but start with adding new things. So maybe you can just start by adding more leafy green vegetables. Right? We know that there's a lot of power in fiber. There's a lot of power in a lot of the nutrients that are found in green leafy vegetables, such as spinach, broccoli, kale. Maybe just adopting a salad once a day, or even making a smoothie that has leafy green vegetables in it. So I think that's one easy thing that you can do. The second thing I would say is try to add more fruits. And when I say fruits, a diverse amount of fruits, we often think about apples, which are great, and oranges, but we also need to have things in our diet that are nutrient dense. And you often find those things in things such as berries. So blueberries, blackberries, strawberries. If you can maybe just add one meal where you add in some berries in your diet, it can make a big change by changing the way that the amount of nutrients that you're getting, but also changing the way that your gut responds to what you're eating, kind of level setting and causing that inflammation to go down.
Thank you very much. And I'm going to iterate. So it's adding water. I feel like that's the easiest to do. You just got to get a bottle, get something that you can transport around. and make sure you're hydrating. I heard you say greens. And
Yes.
I know also from before, because the fiber help us with that gut biome. It helps support good bacteria, the nice kinds that we need, both for digestion, but also communicating well with our brain. And the third is fruits. And I have a feeling some people are going to come for you on that fruit, because I know that there's some people on the don't consume fruit, high sugars, and all of that. That's where specific consultation comes in for different individuals, right? When they're meeting with you, you get to really look at the rest of their profile, their goals, weight, other medical problems, and you can advise them more specifically to their own condition. But I've heard a lot of debates about the fruit thing. I'm like, we all don't. Fruits, we need fruits. And fruits are different colors, different types. But
absolutely. And it's a type of fruit. But you said, as you said, everybody's body is different. And so that was another thing I love about my practice, is that I see people as a whole and as an individual, right? So depending on your body system, certain things may or may not work well for you. But the type of fruit is essential. So I know people may be coming for me. I'm ready for the debate. I want to get the word out there that not every fruit is made equal, right? And what we consume, even honestly, in combination with the fruit, it can get really complex, right? Whether or not how you consume that diet and what you can do to even moderate the sugar levels by adding things like nuts or walnuts or almonds. We could really unpack it, but I would want to leave with just that knowledge and encourage people, if they want to learn further, to definitely come for a consultation, and we can talk one-on-one about it.
Absolutely. So let's get to the fun part. We've given people some things to walk away with, some quick changes they can make in their lives. Some fun part. Something fun about you? And one question off the top, and you can answer a different one if you prefer a different fun question, but how did you come into nutritional psychiatry? What interested you in that?
I love this question because I think it's been a journey for me. I will say experiential knowledge. I actually started learning about the field of nutritional psychiatry really by learning, hey, my body's not feeling right. What is it that's going on? And I started off by doing yoga. During a high stress time of my life, residency training, I started to feel like my sleep cycle wasn't being regulated. And I just felt I wanted to get things back on track. I felt like my body was feeling more overall healthy. And so through that, my first step was like, let me do some yoga. I started off with Bikram yoga. And this is not to say that it has to be Bikram yoga, but what the yoga did was it defined for me my eating pattern. When I did yoga, I had to make sure that I ate things that I would feel sluggish if I try to go to practice, if I ate high fatty foods or if I ate high carb meals. So I started ordering my eating around the practice of yoga because that was essential to me at that time for my lifestyle, to be able to maintain my overall wellness, make sure I was sleeping well. And by moderating my diet, I was like, wait a minute, I feel so much better. And so I continued to learn about it. And this is before, I don't even think there was a field of nutritional psychiatry, but we were really starting to talk about the microbiome and the gut-brain axis at that time. And so I started reading more literature around it. And I found that not only did the science make sense, but I was a witness. And honestly, the more that I got into the practice of it and understood the importance of it, the more made me want to understand how I could incorporate that into the practice of my patients. And so I started reading more studies about it. I started asking patients about how they felt when they were eating. And I actually started, even in residency, changing my patients' diets, whether they had a psychotic disorder or depression. And I really saw the change. Being able to say, I know this works for me experientially, I know that the science and the data backs this up, but then also being able to see it real time with my patients, I think was really rewarding.
It's really powerful. Like, it's always, when we've had a personal experience as physicians and then we can bring that to our workplace, it's such a powerful combo because we're not just quoting a book now, we're saying lived experience.
Yes.
I've done this, I've seen it work.
Absolutely.
How I can use that experience to help you. I think it just brings something additional to our practice as well. That's a cool evolution, very fun evolution into this field. And it's still even as important as it is, it's still an evolving kind of field within psychiatry, and not enough of us are doing the nutrition. I know that I definitely talk about nutrition also based on what I've learned, personal experiences, but additionally also we sometimes give medications that impact people's weight and things like that. It's extremely important that we're then looking at what people are doing, how it's impacting their eating, and so on and so forth, to ensure that our patients are having the best outcomes. Thank you for sharing that about yourself. One more question and then we'll wrap it up. How can people find you? Someone's listening, they're like, I want to go to that doctor. I want to find out about my health and how to eat and all that. how do I find Dr. Watkins-McCall?
Yes, you can find me and learn more about my practice at www.freedommindwellcare.org, all one line. And from there, you can read about my practice, you can read about my treatment approach, and also you can do everything to make an appointment. You can schedule an appointment right there, or you can learn more about, there's some FAQs on my page where you can learn a little bit more about what to expect before you meet with me. You can
What
also...
states do you cover?
I'm sorry.
What states do you service?
Yes, District of Columbia, Virginia, and Maryland, and hopefully to be expanding soon. So yeah, I'll see all of my patients via telehealth. So location is not a barrier. You can be able to have a video visit with me, and my schedule is posted online when you log in. So free access to be able to make your own appointment, and I'll be able to get your information to get back to you. You can also find me on Facebook. I have a page at you can find me Freedom Mind Well Care as well on Facebook. And also you can follow me, Dr. Andy Watkins-McCall on Facebook. And you will find me doing some cool recipes and creating showing you how to make some food that's going to be nourishing your mind and your body, that's easy, because I believe in easy and not feeling overwhelmed. So I want to support my patients through that and be mindful. Part of my practice is guiding you through recipes and helping you create your own recipe module for yourself. So very empowering. Find me. I'm looking forward to helping you through your wellness journey and just excited.
Thank you very much. And you cook, right? How cool. I like to find doctors who do a lot of other fun things outside of just medicine, doctors who do sports, doctors who do... Now I have a doctor friend who does cooking and shares recipes online. So please go check her out. Lots to learn. Thank you very much. This has been great. And thank you for sharing with us, Dr. Watkins-McCall. Again, for everyone listening, I'm Dr. Bolanle Akinrambi. I'm at Bright Minds MD, and we service New York and New Jersey. So between the both of us, I think we got 5 states covered.
That's right. Yeah. We got the East Coast mostly covered.
That's right. So thank you for tuning in. If you have any questions, you can definitely leave comments or ask your questions, and we can connect you, and we'll post both our links as well. That'll be all for today. Thank you so much for joining us, and have a wonderful rest of the day.
Thanks, everyone. Bye.
Bye-bye.
Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and Your Mental Health podcast. Ciao.